Hi guys, I am Palak from the team Immunosciences, and today we're doing this live because as we all know get so much love from our previous life, and we are flooded with lots and lots of questions and lots of love also. All the questions were about acne, gut, and the most asked question was about PCOS. So here we are doing this live on PCOS because this is the best time we can do it, as this month is dedicated to PCOS Awareness Month. So what is PCOS? So PCOS basically the disbalance hormones in women body. So जब women body में male hormone androgen उसकी secretion increase हो जाती है, so that leads to PCOS in any women. So what are the symptoms of PCOS? So the common symptoms of PCOS is hair fall, excessive facial hair growth, irregular periods, and cholesterol, diabetes, and there are more many common symptoms like that. So we have Dr. Deepika Krishna with us. So we are gonna invite Dr. Deepika Krishna to this. So we're gonna invite Dr. Deepika Krishna to this live, who is a physician in nutrition, lifestyle change, and he's a gynecological cancer. He treats gynecological cancer also, and he's the founder and director of Immunosciences. Hi, Dr. Deepika Krishna. How are you?
A very hello and good evening to Palak and all the listeners and viewers here. Palak, that was an incredible start. I am so glad that you are aware with a lot of things about PCOS and PCOD because since you are quite young and the disease, I mean, all the youngsters should be very much aware about this very, very new. I would say it's a very new epidemic because when I was doing my medicals, which was, of course, 2 decades back. They barely had any kind of topic or subject about PCOS because the PCOS tha hi nahi. If you look at your parents, your mothers, there was nothing about it, nothing, never discussed topic about it. But, this current generation or 5 6 years pehle se it's has become like an epidemic, because it is so common now. And yeah, there are ways and means which we would be discussing today, about PCOS and PCOD.
Yes, ma'am.
And I believe
Doesn't know about it. 60% of women doesn't know about PCOS, and उनको teens में हो जाता है, acne problem होता है, उनको hair fall होता है. What they go for? कि शायद ये cleanser मेरे को suit नहीं कर रहा, so they go change that cleanser. They buy some good stuff for their skin. So that's what they do. किसी को भी medical way में कोई नहीं सोच सकी कि मुझे PCOS है, so no one think about that. So today we got a lot of questions about PCOS, so I don't want to be biased about anyone. So I just made some tricks. So we're gonna choose in front of you all guys what 5 questions that he will be answering and explaining everyone about this PCOS and spreading more awareness about it. So the
great.
first question I'll
Let's bring it.
using. So this is the first question. So the first question is, what is the difference between PCOS and PCOD? The most people get so confused between these two. So most of the people
Okay.
get
So
confused.
I am glad, Palak, that this is our first question because it. If I would have spoken all about PCOS and PCOD without telling the difference, so yeah, it would have been very very confusing. So yeah, I'm glad this is the first question. So to begin with, let me tell you that PCOS and PCOD. I'll just take one terminology, although they're almost the same. PCOD has become so common now. The statistics say that one among every 10 women is facing PCOS or PCOD, right? And most of them, 50% of the women, it goes undiagnosed. 50% of women are unaware about this condition if they have it in their body. In fact, some of the women, when they reach by the age of 40, that's the time when they see their type 2 diabetes full blown, flourishing on full blown condition, because they haven't been noticing any of the symptoms, or they might be haven't be avoiding the symptoms. So it is very important to understand that what terminologies are about, what does it say. So let us begin about PCO, PCOD, and PCOS. So PCO is polycystic ovary. When the condition remains to the ovary, then you call the terminology is used PCO, right? Now, the second comes is PCOD, which is polycystic ovarian disease. Now, polycystic ovarian disease is much more related to the hormonal imbalances. Now, what happens? The ovaries, they make immature eggs, and they, release immature eggs, which are not fully mature. And these eggs sometimes, most of the times, forms a cyst. But this happens, the conditions why this happens is mostly of hormonal imbalances, which occur because of stress, because of irregular lifestyle, because of irregular eating habits, because of so much of chemical and toxins around you. So it is mostly stress induced, right? Now the third one is PCOS. That the meaning is polycystic ovarian syndrome. Now, when the ovaries starts releasing excessive androgen hormone, which is a male hormone, and this is the reason why the eggs are not being released from the ovaries, right? So this condition is called PCOS, or polycystic ovarian syndrome. Now we have to understand that polycystic PCOS women sometimes have problem with ovulation, because of course the eggs are not released. Hence they have problem in conceiving child and rest of the other things as well. PCOS, if a female is not having irregular periods, or basically not ovulating and having problems in ovulation, there are medicines and medications via with the help of those. One can always conceive by taking care of the health, diet, etc. If we talk about PCOD, it's a hormonal imbalance, which is very, very easily being taken care of by changing your diet and lifestyle pattern, and also with some supportive medications. So this is the basic differences between PCO, PCOD, and PCOS, because there's so much of confusion, right?
Okay, ma'am. Thank you for your information and you shared with all of us. So the next question we have is, so we got this question from some of the guys. So what caused PCOS? No one in my family has PCOS, but my older sister has started to develop its symptoms. Does it make my chances to develop PCOS more likely? So her sister, older sister.
Okay, yeah. That's a very relatable question, because of course, somebody in the family facing PCO or PCOD, PCOS, and definitely this question arises very, very normal, because it's not a very easy journey to be in PCOS and to lead a healthy life, because it really requires a lot of effort. But I won't say it is impossible. It is possible. But speaking about hereditary, yes, it can be hereditary. I mean, which the data shows that yes, it is a possibility that if you have PCOS in your family, there are chances that the other person or the same bloodline might have the same conditions. But I would like to differ here. My belief is that our parents, our dadi, nani, and in fact the poor ladies who come to work at your home, they don't have any conditions like this. Our dadi, nani, those days, it wasn't even a subject.
Yes, ma'am.
Although having at the same bloodline, there might be a reason that at that time the chromosomes or the DNA or the DNA carrying the some PCOS was not full blown there. It might be chances. That can be a reason. But I still defer to believe that, and I totally believe that the lifestyle choices and the food habits makes a lot of difference in your PCOS conditions. If you see a poor lady who comes to work at your home, cleaning your house on a daily basis, there must be some commonality between her and our dadi's lifestyle. Or maybe they must be, it's a food of thought, one should think. I would like to give this food of thought to my audience here, that think about that, how a poor lady who is not having any PCOS, and also your dadis never had any PCOS, there might be any commonality. Maybe their eating, their lifestyle, their their regular work pattern was there, something different. Maybe they were more walking, they were more exercising, they used to eat more prana rich food. They are something different, right?
Yes,
They're not
ma'am.
eating a lot of processed food. So it's a food of thought. Although there is not 100% proven that, it's all genetic, but yeah, they are both the side of the coins.
Okay, ma'am. Okay. So the third question is, does PCOS increase the risk of cancer?
Okay. So, let's talk about, before I'll go to if it increases the risk of cancer or not, I will like to tell our listeners here that worldwide PCOD, how do you diagnose PCOD? So worldwide, there is a criteria which is called Rotterdam criteria. Now in Rotterdam criteria, there are 3 points how you diagnose PCOD. Number 1 is, of course, your irregular periods. Now, irregular periods, the periods can be very, very scanty. It can be excessive. It can be, someday you're getting, someday you're not getting. It can be, one day, it can be mix of profuse. It can be, too much smell. That's an irregular period. The second one is, of course, the male hormones. But there are clinical and bioevidence-based male hormones, right? So now, bioevidence-based male hormones, of course, when you do the testing and you find out that you have male hormones in your body, and clinically, when you see that you have, like, somebody is having facial hairs, or excessive sweat, or maybe maybe irregular sleep or something like that. So those can be the sign of higher androgens, which is a male hormone. So that's point number 2. Point number 3, of course, it's the ultrasound. When you do ultrasound and you find out that some of the ovaries, the sizes are more than 10, and it's around 20 of the ovaries are having more than 10, then that means it is a sign of PCOS. So these are the 3 criteria by which you diagnose PCOS. Now, speaking about PCOD or PCOS converting into cancer, yes, I would say that PCOD and PCOS, PCOS in particular, are a very high risk, are very alarming symptoms. PCOS sometimes, a lot of time, face things like diabetes, high blood pressure, then there is eating disorder, and inflammation in your body, which is almost continuously, and it might lead to cancer of the endometritis. Now we have to understand that what is this cancer? So the inner level of the uterus, the cells in the inside of the uterus, it outgrows. That is the time when you realize it's the cancer of endometrium. Well, again, a lot of evidences we still don't have, but it might be a chances. It can be that your PCOS might convert to endometrial cancer if not been taken care, or if not been treated properly on time. So yeah, it's an alarming situation, like I said.
So, ma'am, what you suggest
I hope that
people?
answers the question.
Yes, ma'am. So, ma'am, what you suggest people having cancer? Like they're having PCOS first, then they're having cancer. So, what do you suggest?
I would always tell my patients who come to me that चीजों को आगे बढ़ने ही मत दो. When you see that you have certain level of, now how, like I told you, the criteria of diagnosis, right? Now if you talk about the symptoms, like आपको पता कैसे चलेगा that आपको PCOS है, right? So not one symptom will diagnose that PCOS. If you're overweight, ऐसा नहीं है कि आपको PCOS है. Or if you are having a irregular pattern of hair, that does not prove that you have PCOS. But if you have series of symptoms like irregular periods and facial hair or male hormone excessive hair, unnecessarily sweating, not getting a good sleep, and your digestion is disturbed, and then you have like terrible mood swings and also gaining weight. These are some alarming symptoms which you want to consider, and you want to go to visit a doctor to get a proper checkup done. So all the listeners, I will tell, if you have any of these or maybe 2 or 3 of these symptoms, you should always consider to talk to a doctor, get a proper test done, and then so that you can start your treatment as soon as possible. I mean, delaying the things may complicate the things more, right? So, some of the problems which occur during severity of PCOS is, of course, like I spoke, type 2 diabetes, which let's understand why this happens. So, insulin is a hormone which controls our blood sugar, right? Now, हमारे blood में जब sugar आता है, insulin picks that sugar and it uses it for energy and different work in our body, right? Okay. But now, if in a condition of PCOS, there is excessive of blood sugar, which is in the blood, but insulin is not able to pick those blood sugar. This is called insulin resistance. Basically, आपकी body में sugar है, पर insulin उसको pick नहीं कर पा रहा. And when insulin is not able to pick, then the body realizes कि body में blood में sugar है, insulin pick नहीं कर पा रहा. That means they need more insulin. So insulin और ज़्यादा body बनाने लगती है, which also complicates the symptoms of PCOS. In fact, the sad part is because of excessive insulin production, sometimes your hormones get imbalanced so much that they start producing androgens, which is our male hormones.
Yeah,
okay.
then it get more.
Yeah. So, another kind of a thing which you should be careful about or you should be knowing is a low-grade inflammation. So, in a condition like PCOS, PCOD, there is always a continuous inflammation. Now, inflammation जब होता है, that is there to protect our body. अगर आपको चोट लगी है, you will get inflammation. It is happening to protect your body, to heal it immediately. Similarly, if you have any illness, you will get mild temperature, which is a symptom of inflammation, that you're having something in your body, right? And you want to treat it immediately. Now, what do I mean by low-grade chronic inflammation? With PCOS, because the conditions, they develop slowly and gradually, and it mostly goes unnoticed, that's why there is this chronic inflammation which needs to be taken care of when it is acute. जब वो शुरू हो रहा है, when you're starting feeling uneasiness, that's the time it should be taken care of. You do not want to be there for a low grade chronic inflammation में लंबे time तक नहीं रहना है. That would cause more and more complication. In fact, still, if you feel that somebody is there for a longer period in an inflamed atmosphere or inflamed body, they immediately should go and consider seeing a doctor.
Yes, ma'am. So that's what I was saying. कि जितने भी symptoms है, just don't ignore that. Consult a doctor right after.
Absolutely, Pala. And, of course, there are markers to find out your inflammation, which is the blood test. You can definitely find out that what level of inflammation you have in your body. And the third thing which one needs to be very, very careful of, which we are ignoring a lot of time, is, chemicals. Now, chemicals are all around us. चाहे वो पोछे का phenyl हो, चाहे you're washing your clothes with some things, your perfumes, it's the aluminum ka foil, whether it's plastic ball, they all have chemicals. Right? Now, all these chemicals messes up our hormones completely, and which we realize gradually, slowly. with conditions like this, PCOS and PCOD. So we need to be careful about what we are putting in our body, what kind of atmosphere are we living in. If you are using any kind of product on your body, or you're around that kind of product, you should see the label behind it. Okay. So you should check the label behind it, go through the carcinogen ingredients. Yeah, you heard me right. A lot of ingredients which are putting on your body eating carcinogen. So do check the label, guys. It is really important. So yeah, things like this are just messing up.
Okay, guys, there's some network issue I see. So we can just wait some couple of minutes so that it will get better. Okay. So Dr. Deepika Krishna is left because of some network issues. So let me just invite her and rejoin her. Yeah.
Yeah.
Okay. Yes. Yes. Um, okay, you're not audible now. So we are getting some network issue. So let's wait for 5 minutes and see.
Hello, am I audible? Okay, let me just move from here. Hello, hello,
Hello.
hello.
Hello. Yes, ma'am, you're audible.
I'm glad I'm audible. So yeah, very quickly I'll tell that, this is the food of thought which one should think about, that what our grandparents did differently, what is the poor maid which is coming to your house doing differently. Maybe they are, eating raw, maybe they are eating, some things which we are not doing. Maybe they are avoiding processed food. Maybe they are not they were not using so much chemical based thing. There is something, it's a food of thought, and we should all think about it, that what is the thing which they have been doing differently which we are not doing.
Yes, ma'am, exactly. So can we move on to next question? So the next question is, what are the myths and stereotypes we must break around PCOS?
Oh, that's a very good one. Actually, the biggest myth is that the woman with PCOD cannot conceive. So that's the biggest
Yeah.
myth. So yeah, there are some problems and complications, but it does not mean that they cannot conceive. They can always conceive and have as many number of child they want, but of course with some help of medicines, or maybe some diet and lifestyle change. And the second biggest myth is that a woman, if having PCOS or PCOD, would not be able to change the weight, or they won't be able to manage their weight. So that's again a very, very big myth. There are a lot of weight management trainings, weight management programs which one can join, and always have the same desired weight which all the other women without the PCOS can have. And of course, the third myth again, which some of them like to believe, that having facial hair is absolutely a must symptom of PCOD or PCOS. Again, it's not very, very important, or you won't see every PCOS person having a facial hair. Like I said, a lot of time PCOS and PCOD goes without diagnosis. So yeah, these are three very, very big myths which people think that, they will have. In fact, anyone diagnosed with PCOS or PCOD, they get scared that, ma'am, we might be having these kind of, would be getting these kind of symptoms. How do we avoid these kind of symptoms? So let me tell you, ladies and gentlemen, that you don't have to be scared of anything. It's just a lifestyle thing which one needs to take care of. And when I speak about lifestyle, right medication, a very good choice of planned diet, and changing your sleep and waking patterns. Those are absolutely must when we talk about lifestyle.
Thank you, ma'am. Thank you for the answer. So we don't take much of your time. So the last one is, does PCOS affect our mental health?
Uh, of course, I will say yes and no. Yes, why? Because, no, let me answer the no why. No why, because PCOS and your mind doesn't have any connection. There's no nerve or thing going straight away, or there's no bloodline which is affecting to your brain. But yes, why? Because when you don't find a solution of PCOS and PCOD, then you might have things like your dopamine dips down, your serotonin dips down, because you feel sad, you feel that you are trapped and you have to be like this for the life. But that's not the case, and that thought makes you eat different things and maybe just give up on things, or maybe just think that, okay, this is what I have to be for, like this, for my entire life. Or maybe people who think that they won't be able to conceive, yeah, they have been constantly fed by these negative thoughts, which I'm sorry to say, people around them, or in fact the Google or everywhere the search engine also says. So yeah, those kind of ideas and thoughts definitely spoil the mental space of a person dealing with PCOS and PCOD. So yeah, otherwise scientifically it does not do anything.
Yeah, exactly. Thank you, ma'am. And also, the what diet plan or what kind of diet should they take?
Okay, so always remember, when you don't know anything कि क्या खाना चाहिए, just follow simple rule of eating natural and local, right? So now, speaking about natural and local, avoid this processed thing and eat food which has got prana. Let me ask you a question. If you have a mango and a mango tart, which one would you pick, Palak?
Of course, mango tart.
Yes. So, we all would love to eat mango, but mango is more prana rich food than mango tart. So food eating more simplified way, or maybe cooked in a more simplified way, those are more healing and more, suited and available. I mean, where you can absorb the maximum nutrient from the of the fruit. So this is how you have to think about your choices which you make. That you want to eat the simpler form, which where the food is less cooked or not cooked, or maybe just seasoned with something, or you want to eat the food which is more processed and it might do some damage to your health. So you're just making simple changes or giving a thought to the food which you are putting in your mouth is absolutely very important. And let me tell you, the fat diets, which is like keto, PCOS हुआ है तो keto लेना चाहिए, और carbs कम खाना चाहिए, protein ज़्यादा खाओ. These are, fad will always make you mad. So just don't follow any fad. Do what you want to do. Eat local, natural. Eat up आराम से बैठ के खाना खाओ. Don't feel distracted by any devices while you're eating. Chew your food properly and avoid processed food. So these are some simple ways which one should include. Yeah, eat good fiber, eat good quantity of protein, eat good fat, and also good fibers. Include lots of fruits and vegetables in your diet, and be proud of your food. Never be guilty of your food, because if you're being guilty of the food which you're putting in your stomach, you're of course kind of cursing the food. So how will the food do good to you? So always bless the food, and whatever, even if you're eating chole bhature, just be happy and enjoy the food.
Yes, ma'am. Okay, thank you for your answers, ma'am. And thank you for taking so much time for us and just educating us all about PCOS on this PCOS Awareness Month. So thank you. And yeah, we get all the comments that it's very helpful, informative, and everything. So thank you guys for all your feedbacks. And thank you, Dr. Ma. Thank
Bye
you,
bye.
Dr.
Thank you, Palak.
Ma. Thank you. So this PCOS Awareness Month, it's we're gonna, we have some presentation over there, so I'm gonna just read it out for you guys. So yes, having PCOS can feel like a battle every single day, and this has to be because PCOS is a condition that doesn't get the support, the awareness, the time of the day that it deserves. I speak with women every single day who says it's better to wake up and with no energy. It's a battle to try and lose weight when your body doesn't want to. It's a battle to keep your hair growing here, not here. So it's a battle to try and stay positive and to make your mind positive. It's that every single day is a battle. And I literally get so pissed because everyone is living their normal life and people with PCOS, what they want, they just wanted to live normal life. So that's what they're striving for. They're striving for living a normal life. So is it too much to ask for? So that I keep on you guys to decide, and we end our live here. Thank you so much to join, and again thank you Dr. Deepika Krishna who educated us on PCOS on this movement on this month which is dedicated to PCOS. Thank you everyone for joining. Bye bye. We'll see you in our next live.